My particularly interested in clinical microbiology is in antimicrobial resistance and also in antibiotic susceptibility testing. That's mean the methods that we are using in the laboratory to know if a microorganism is susceptible or resistant to the antibiotics. And according to this, we can infer if the patient is going to be treated adequately with some antibiotics or not with the other antibiotics. So we make predictions with this study in the laboratory. Antibiotic resistance is a big issue also in this type of congress because it means that you can offer a lot of data in terms of the clinical microbiology, but also you can make correlation with the clinical situation of the patient. So there is a very good interaction in between clinical microbiologists and clinicians that are responsible for the patient. Of course, not all the resistant mechanisms are similar, not all the microorganisms are similar in that case. It depends also in the treatment of the patient. But what it is clear is when you have a resistant microorganism that make an infection in the patient goes in a worse situation than if you have a susceptible isolate. And also, there is a clear correlation with mortality with some of these microorganisms, particularly methicillin-resistant staphylococci or gram-negative microorganisms with some beta-lactamase-related resistant mechanisms. And this is very, very clear. The mortality is higher in this case. It has changed a lot because when I started in clinical microbiology, we have good antibiotics. We still have these antibiotics nowadays, but the problem is that some of these antibiotics are not very sure that you are going to be successful with them because of the resistant mechanisms that we have. So this is one of the problems, the increases of the resistant rates, and the other problem is that we have less investment in new antibiotics. So the combination of this situation makes that we have to start working with new ideas and the new management of the patients. To use biomarkers could be a good approach. That's because with this type of studies, we can identify which patients should be treated and which patients should not be treated. Because one of the importance in the resistance, in the development of resistance, is the pressure that the antibiotics makes to the microorganisms. So if you decrease the use of the microorganisms according to this data that we can obtain with the biomarkers, this is a good approach to give a better option to our patients. The procalcitonin is one of the examples that we have, but I know that we will have another biomarkers that probably could be, let's say, complementary of the other one or more specific in some cases. One of the discussion is in the management of the patient, this is clear, and also to anticipate when we have to treat the patients, and most importantly, when we have to end the treatment of the patients. Because as far as I previously said, there is a lot of pressure with antibiotic to the microorganisms. So if there is a pressure, the microorganisms can develop resistance, and if you stop using the antibiotic because this biomarker offer you the data that you can stop this treatment, the development of resistance will be lower. Normally we use antibiotics, let's say 5 days, 7 days, or 14 days. It depends on the type of infection. Are we doing the right schedule? So these biomarkers can help us to reduce the use of antibiotics. We are in a global world now, so what is happening in the United States is happening also in Europe, in Asia, and I think there is a lot of efforts of identifying which is exactly the situation that we can use. One of the best examples is in the intensive care unit. The patient is there, the patient is in a critical situation, may have an infection also, so with this biomarker you can manage better the patients. Well, in the next 5 years, probably will be the availability of these techniques as a more broad issue. New biomarkers also could be offered in 5 years' time. And also the way of using this biomarker, just to identify exactly which patients will be benefit to this way of working. We call superbugs. It's a multi-drug resistant isolate that has also a lot of pathogenicity issues. So it's important because the microorganism is pathogenic to the person who has an infection, but also because of these microorganisms resist the action of the antibiotics. This is a superbug. You don't have a lot of options to treat the patients. Well, I think there is a pretty presentation in the European Congress, which is from the European Society of Clinical Microbiology and Infectious Disease. And I think this Congress is important because it merges the technology of the clinical microbiology, the data that we can obtain in the lab, and also this correlation with the clinics. And we need this type of data to make more advanced in science, but also the last goal is the patient, so we need to offer better opportunity to our patients. This is an initiative just to focus all our attention to identify the patients that are in a critical situation because they have a sepsis. They have a sepsis. This is an alarming situation, as we may have with a heart attack, and we have to identify very critically this patient because it's also important to reduce the time that you are using to attend this patient. We learned this with the heart attack. And we need, as soon as you act with this patient, you obtain more benefit. The patient has more probability to survive. So if the patient goes in a sepsis, you may have some data that the patient is going to this situation. So it's very, very critical to identify that. And the World Day of Sepsis is putting a lot of efforts to say that we have a responsibility with this type of patients. So we need to do our best for them. Well, of course, the economical cost of this patient is important. You can measure this in time of the days that the patient is going to be in the intensive care unit. But of course, we have to measure also this in the failure of the treatments and also, let's say, in the death of the patient. If the patient is not surviving, this has a lot of tremendous economical cost. Our research is more related with antibiotic resistance, just to identify which microorganisms are resistant in terms of surveillance study, the emergency of resistant mechanisms, and also to know which are the resistant mechanisms we have behind these microorganisms, and also to try to identify specifically which microorganisms are more able to acquire the resistant mechanisms. So we need this type of information also to put efforts and to do more global measure to avoid the emergency of the resistant mechanism. We are living in a globalization of the world, so we have been understanding for many, many years that the microorganisms develop resistance. The resistant development is because we are using antibiotics, and the antibiotics are a good drugs for treating this patient, but we have to do our best. We are now starting to understand that the way of using this antibiotic can be different, as we are doing so far during these years, just to avoid the emergency of resistance. This is in one side. And in the other side is that we need new approaches to management this patient. The use of the biomarkers can be a good approach. As far as we will understand this, we will use better antibiotics and we will benefit from the knowledge of using biomarkers.
Thermo Fisher Scientific products are distributed worldwide. Not all intended uses and applications mentioned in this video are registered in every country.